This conference will now be recorded.
So this class is tetracyclines, okay? This is also called as a broad spectrum antibiotics because after penicillin this antibiotic was discovered, and when they discovered it, it was seen that these both the bacteria, fungi, all those things, and even some viruses were also susceptible to this tetracyclines. So this is named as a broad spectrum antibiotic, okay? So after finishing this class, we will see this clinical examination, okay? Then you can see how it works. Now coming to the tetracyclines, as usual I have told you, like first you have to write the chemical structure, okay? I couldn't get the diagram here, but the name itself is telling tetracyclines. Tetra is 4 and cyclines are 4 cycles, okay? So if you see any chemical structure with 4 cycles, that is the 4 carbon benzene rings, and you can tell that that is a tetracycline, okay? It is further divided into 3 types based on the duration of action: short acting, intermediate acting, and long acting. Okay, short acting chlorotetracycline, tetracycline, oxytetracycline. Intermediate demeclocycline, metacycline, which will act for around 12 hours, and long acting are doxy and mini, which will be acting for around 16 to 18 hours. Okay, so that is why doxy and minicycline, these are used only for once a day course. Okay. And another new antibiotic is discovered in this tetracyclines only, which is just a congener of the minocycline. Okay, that is called as an Epigastric, and which is having a half-life around 36 hours. Among all these things, chlorotetracycline, oxytetracycline, these are not being used now because of severe side effects. Only the tetracycline and this doxycycline, minocycline are being used now. Okay. As I have told, chemical structure, free tetracyclines, these are crystalline amphoteric structures of low solubility. Okay, it is chemical structure is telling crystalline amphoteric. So this chemical structure itself is telling the nature of this antibiotic, that they can crystallize anywhere. Okay, if they combine with any other metals or ions or any minerals, they can crystallize. Okay, and it is also telling it is having a low solubility. Okay, but the other newer compounds are having higher lipid solubility. These are also available as hydrochlorides to increase the solubility. These solutions are acidic. Okay, these are not basic, these are acidic, and as I have mentioned, because of its property of crystallization, they can chelate with the metal ions, which can interfere with their absorption and activity. So whenever they are chelating with these metals or minerals, what will happen? They form an insoluble complex with these metals. So whenever the complex is formed, it will become very big in structure, so the absorption will be decreased. So whenever the absorption is decreased, obviously the activity will also be decreased. This tetracycline is a glycyl cycline, as I have told you, minocycline derivative, but its absorption is very good. Coming to the mechanism of action, you know that this is a protein formation, right? RNA protein synthesis. There is this chain elongation, and the last one is translocation. If you see in the first picture, this is 30S ribosome. Okay, so whenever this 30S ribosome is there, C3, C4, there is an acceptor site, and that is denominated here in the pink one with the letter A. Okay, so what happens is these tetracyclines, they normally what happens, amino acid mRNA chain, whatever it is there, this it will move from the P side to the A side and then attach a new amino acid there. So after that, again it will go back to the P side. Okay, so these tetracyclines will inhibit the chain elongation in the third step here. Okay, it will not allow the tRNA, it will not allow the amino acid complex to move from P side to the A side, because the tetracyclines are already bound to the A side. Okay, so they cannot go to the A side. Once they cannot go to the A side, the new amino acid cannot bind to this tRNA chain, and obviously the chain elongation cannot take place. So a new RNA cannot be formed, new proteins cannot be formed. So obviously the division of the bacteria will be stopped. So because it is involving RNA synthesis, it is inhibiting RNA synthesis. This is bacteria. Main action is bacteriostatic. Okay. Now, resistance, it always depends on the mechanism of action. Okay, tetracyclines, they have 3 mechanisms. Actually, the mechanism of action, main mechanism of action is inhibition of this chain elongation. But how it is going inside the bacteria? Because of it, if it is having high lipid solubility, it can go easily by passive diffusion. but not all tetracyclines have good lipid solubility. So they need some carrier proteins. Those are porins. Okay. So when this protein pumps or porins, whatever are there on the bacteria, it can go easily inside the bacteria and it can stop the chain elongation. Okay. So if there is impaired influx, means if the tetracyclines are not able to go inside because of the porins, or if the tetracyclines have already gone inside, these bacteria are pumping out. That is increased efflux. Efflux means going outside the bacterial side. So increased efflux by an active transport protein pump. So that is the first way of resistance. Either you stop the porin channel production, or once bacteria antibiotic has gone inside the bacteria, it will pump out increased efflux. That is one way. Second one is ribosome protection proteins will be formed. Okay, those ribosome protection proteins, they will interfere with this tetracycline binding to the 30S ribosome. Okay, if these proteins have very high capacity to prevent the tetracycline to prevent the binding to the ribosome. Okay, and another one is enzymatic inactivation. Through enzymes, it will produce some enzymes which will inactivate this antimicrobial agent. Okay, so these are the three main ways of resistance. Pharmacokinetics, absorption is very good with all that, but what happens is because of its crystallization, absorption will be decreased. Okay, so absorption occurs mainly in the upper small intestine, and it can be impaired if at all you are giving with the food. Okay, especially all main tetracycline, oxytetracycline, all those things. But doxycycline and minocycline, these have high lipid solubility. So these resistance mechanisms will not work in this doxycycline and minicycline. So that is why still doxy and mini are used for wide range of infections even now. Okay. So if you are giving with food and if any food is having some metal ions, take iron rich food, those iron it will go and it will crystallate with this tetracycline and it will form crystallization. So you should always give half an hour before food or 2 hours after food. Next one is divalent cations like calcium, magnesium, iron. Calcium is which is present in the milk. Okay, aluminium. So if you are taking these tetracyclines with the antacids which are rich in magnesium and aluminium, obviously it will crystallize and tetracyclines will not act. So tetracyclines, antacids should not be combined together. And by dairy products which are rich in calcium, antacids which contains multivalent cations, and by alkaline pH. Because as I have mentioned in the chemical structure, the tetracyclines are acidic structure. If you are given combined together with an alkaline, obviously what will form? It will form a salt and water. Acid and alkali both together react together to form a salt and water. And obviously any salts cannot be absorbed here. Next, that is about the absorption. Coming to the distribution, these are widely distributed throughout the tissues and the body fluids except cerebrospinal fluid. Okay, and even in tears, saliva, breast milk, even to the it can cross through the blood placenta barrier also. Okay. Process the placenta to reach the fetus, and these are also excreted in the milk. So no in the pregnancy and also no in the lactation time. Okay, because it is a result of chelation with calcium. Tetracyclines are bound to the calcium, and so if you are giving in infants or growing children, the milk, whatever the tetracyclines, it will combine and the calcium will not go into the bones. So it may damage the growing bones and the teeth here. Okay. And these are most of the time tetracyclines are excreted in the urine only, except doxycycline, which is excreted in the bile. So that is the reason doxycycline and tigecycline is also which are excreted in the bile. So in kidney failure patients, you can use happily doxy and tigecycline. But other tetracyclines, a very big no if you are giving in a renal failure patients. This is just to tell you how good the bioavailability there. If you are giving on an empty stomach, easily it can go, because empty stomach, more HCl, acid, absorption will be this way. Absorption of the drug will be good. If you are giving an antacid and if you are giving a milk, see the absorption of the drug will be very less. Okay, and only minocycline provides the therapeutic concentrations in the cerebrospinal fluid. So if you are giving for any meningitis infection, you can give minocycline, but other substances cannot be given. IV, IM injections are also not used now because thrombophlebitis is one side effect which can occur with the tetracyclines. And doxycycline, it is excreted via the bile, so it can be given in the renal failure patients. And intrahepatic circulation is one which will happen with the tetracyclines because they are reabsorbed from the bile, metabolized to gluconides, and then they are excreted in the urine. Okay, so doxycycline, definitely intrahepatic circulation will take place, so less dose will be sufficient for any infection. Coming to the spectrum, here I am telling both spectrum and the uses so that you can remember both. Okay, so as I have told you, tetracyclines, those are broad spectrum antibiotic because it will act on all organisms, even protozoal infections, phytocoids, all those infections. Okay, coming to the gram-positive Bacillus anthracis. You know Bacillus anthracis, what it is? It is a plague. Okay, so for the treatment of plague, it is very good. And gram-negative rods, especially Brucella, Vibrio cholera, and Yersinia. Okay, here Vibrio cholera, previously if they tried other drugs and still it is not working, go for this doxycycline, which reduces the number of, because upper intestinal tract absorption of the doxycycline is good, it reduces the number of intestinal vibrios and also fluid replacement. Okay, coming to the anaerobic organisms, Clostridium infections, Clostridium tetani. Even for tetani also, one dose of doxycycline will be very good. Spirochetes like Borrelia and leptospirosis, the Lyme disease with the Borrelia and leptospirosis with the leptospirosis intervals. Here also infection will be like skin lesions, headache, fever followed by meningoencephalitis, and eventually arthritis will take place with the Lyme disease. And a single 200 milligram of doxycycline within 72 hours of a tick bite can prevent the development of this disease. Prophylaxis also, it is very good for the spirochetes. Okay, coming to the mycoplasma, not Mycobacterium tuberculosis, mycoplasma, and pneumonia will become mycoplasma. Okay, this is a common cause of the community acquired pneumonia, especially in the young adults. Okay, where they are staying in the military camps because they get infected with all the insects. Okay. Here also treatment with doxycycline will very good, short duration of the signs and symptoms, and treatment will be very good. Okay. Coming to the chlamydia, this is a sexually transmitted diseases, especially it causes non-gonococcal erythritis, PIDs, and lymphogranuloma varoma. Okay, here also doxy or azithromycin is used. Other infections are tick bite infections are rickettsia, Rocky Mountain spotted fever. Here also doxycycline is very good. Remember gram-positive, gram-negative. Okay, very good. Cephalosporins, penicillins will be very good. But if you are going for the other atypical organisms like mycoplasma, spirochetes, chlamydia, rickettsia, doxy is the best choice here. Even for some dengue caused by the plasmodia, even in some malaria also, doxy is very good. Okay, so tetracyclines, these are very good first choice of drugs for these other infections. Okay, so here why I have mentioned all this thing is spectrum and uses. If you study together, you can remember all the bacteria names also. You can remember also the how the disease will occur and how you can treat the disease. Okay. So based on this first choice of drugs, this is the first choice of drugs for chlamydian, non-specific urethritis, endocephalitis. Especially urethritis epicytis means we'll go for the gonococcal only. First cause is gonococcal, but chlamydia is non-gonococcal cause. Okay. Here doxycycline 100 milligram twice a day for 7 days will be given, and the other infections like lymphogranuloma venereum, here also doxycycline. Granuloma inguinale, okay, you know, inguinal infection of granuloma, donovanasis. Tetracycline will be given 500 mg 4 times a day for 3 weeks because tetracycline is a short-acting drug. And other infections where it is first choice is atypical pneumonia, cholera, brucellosis, plague, relapsing fever, and rickettsial infections. Here doxycycline can be used singly or you can use in combination with the other drugs also. Coming to the other uses where it is a second choice drugs are tetanus, anthrax, actinomycosis, and listeria infections. First choice of drug is always penicillin and ampicillin. Then the second choice of drug is doxycycline. Okay. And if there is any penicillin resistant granuloma inguinal only. This is a non-penicillin resistant, and here also first choice of drug is ceftriaxone, amoxicillin, azithromycin. Then the second choice of drug is this one, doxycycline. Okay, syphilis, where patients are allergic to penicillin. Syphilis, remember, penicillin the first degree of choice. Okay, first choice, always penicillin. But if the patient is resistant to penicillin, then you go for the cephalosporins. You have to see if the cephalosporins are also sensitive or not. If cephalosporin they are good, okay. If they are not good, then you can go for the doxycycline. Okay. Leptospirosis, doxycycline is used, and chlamydia pneumonia, first choice of drug is azithromycin and then doxycycline. Chantroid, again ceftriaxone, azithromycin is the first drug of choice. Tularemia, streptomycin is the first drug of choice, and then go for the doxycycline. Streptomycin, it is an aminoglycoside. Okay. Other uses where it is not like these drugs, doxycycline is used really, but if there is an atypical case, okay, you are supposed to take urinary tract infections only. An atypical case of urinary tract infection where it is not being cured with the general sulfonamides, fluoroquinolines, cephalosporins, then if you try this doxycycline, it may work there. Okay, so other uses means where there are atypical cases where the normal antibiotics are not working, then you can go with the tetracyclines, especially the doxycycline, minocycline. Okay, so urinary tract infections, community acquired pneumonia, in the spectrum I have mentioned with the community acquired pneumonia. See here, mycoplasma pneumonia in case of community acquired pneumonia in young adults and in people living in close confines such as military camps. Okay, so there in such cases also doxy will be very good. Amoebiasis, normally metronidazole and the other drugs like ornidazole, metronidazole and fluoroquinolines are commonly used. But if still they are not working and the patient is still suffering with the dysentery, then try this doxycycline, it may work. Okay. And for chloroquine resistant Plasmodium falciparum malaria, we will generally give this Chinese drugs. Okay. If still some cases where they are also resistant means again doxycycline will work here. Acne vulgaris is one thing which is a cosmetical disease. Okay, where most of the young women and young boys, okay, they will be suffering with this acne vulgaris. But why we need to give antibiotic is because of very high risk of secondary infections through because of the itching. We'll keep our fingers on the face of that acne and we'll start irritating those acne. Okay, some people have this very bad habit of pricking your acne. Okay, so as our hands will be very dirty every time, so those nails where the organisms are embedded in that nail beds, they will come and they will infect that acne. Okay, so to treat that other infections, again acne vulgaris, doxycycline is one best drug to treat those secondary infections in the acne vulgaris. Okay, and COPD, chronic obstructive lung disease, which occurs through the pollution or because of the chronic obstructive lung diseases, because of the pneumoconiosis, all those things. But here again, if there is any chances of secondary tract infections, again you can use this doxycycline. Okay, coming to the side effects. Here the tetracyclines, as it is absorbed in the upper intestinal tract, but the main common thing is gastritis. First thing is gastritis, epigastric pain, again nausea, vomiting and diarrhea because of that irritating property. Okay, so because of that irritating property and crystallization property, you will have this epigastric pain, nausea and vomiting. Okay, intramuscular injections of tetracyclines will be very painful, and if you are giving IV also, thrombophlebitis will occur. So that is why tetracyclines are mostly preferred oral drugs only. Injections, they are not given. Okay? And liver damage, most of the drugs, as I have told you, enterohepatic circulation of the drugs will take place. Okay, and what happens during this time? Sometimes a fatty infiltration of the liver and which lead to jaundice will take place. Okay, so which is reversible if you stop taking the drug. And kidneys also they will damage, which is a reversible damage, that is called Fanconi syndrome. Okay, Fanconi syndrome, where the outdated tetracyclines, means the tetracyclines which have got expired, especially the amino tetracyclines and oxy tetracyclines, they will, what happens, the outdated tetracyclines, once they go and reach the proximal tubular, they form another they disintegrate, and those disintegrated metabolites, they will go and they will destroy the proximal tubular damage. Okay, those are the degraded products. Okay, so that when the proximal tubular tract is damaged totally, that is called Fanconi syndrome. But if you're stopping the drugs, this condition is reversible. Okay. Next is phototoxicity. Okay, you have to remember this phototoxicity. A sunburn-like reaction may take place with the doxycycline and demeclocycline. Most of the patients I have seen, one of my friends also having this skin reaction with doxycycline. Okay, so a sunburn-like reaction will take place. Sunburn means if you are going into the sun, your skin will start prickling and it will become pink and red. Okay, and sometimes severe skin reaction means exfoliative dermatitis can also take place on the exposed parts. So if you are getting exposed means don't go outside the sun. But if you have to go means cover your head, your face and your exposed parts like with your hands and your ankles with socks and with your gloves. Okay. And nails also, because of this calcium chelating property, the nails may also distort. Okay. So doxycycline will take place. And actually, last week or 2 weeks back, I have taken, because my upper respiratory tract infection was not coming down with many other antibiotics, I took, and again the same thing happened. The nails were breaking very easily. Okay, so distortion of nails is very common. Okay, and teeth and bones also the same thing. If children they are taking tetracyclines, teeth, the calcium, whatever the calcium is there in the teeth and bones, this calcium go in the teeth and the bones. They combine with these tetracyclines and they will be distributed on the teeth. So you will see yellow discoloration of the teeth and the bones because of this tetracyclines. Okay, tetracyclines, they have the golden yellow color. Okay, actually initially the first tetracyclines they discovered were named off because of the golden yellow color only. Oreo tetracyclines. Okay, you remember that chemical name of the gold is Oreo, right? So because of that golden yellow color, these tetracyclines were initially named as Oreo tetracyclines. So in the teeth and bones also you will see the yellow discoloration because of that yellow color. Okay. And as usual, if this is contraindicated in the pregnancy, if you are taking from the mid-pregnancy, 5 months of the extrauterine basically being tested. Okay. And brown discoloration. Switched on the audio, please mute your audios. Brown discoloration, ill-formed teeth, and these ill-formed teeth are more susceptible to caries, that is the infection. Okay, and if they're taking from 3 months to 6 years of age, they will affect the crown. You know that crown, right? The upper part of the permanent anterior dentition. Okay, and if you are taking during late pregnancy or childhood, they can cause temporary suppression of the bone growth. So tetracyclines are completely contraindicated in pregnancy. And the next one are anti-anabolic effect. You know, anabolic means more ammonia, nitrogen is taken, and which will lead to good muscles. Anti-anabolic effect here, they are producing negative nitrogen balance. Means nitrogen in our body is disappeared, and it can increase the blood urea. Okay, so this is causing negative nitrogen balance. And if it is going into the CSF also, there is chances of increased intracranial pressure, but this is very rare. And diabetes insipidus may also occur only with the demeclocycline, okay, because it is having an antagonizing property to the ADH action, so it may cause diabetes insipidus. This is sometimes asked in your PG and transcripts, and also in your Viva also they will ask which drug will antagonize anti-ADH action. Okay, so this is called demeclocycline. Okay. Next, vestibular toxicity. Minocycline is one drug which is causing vestibular toxicity with ataxia, vertigo, and nystagmus. Okay, ataxia, they will not be able to walk with a balance. Vertigo, you know, reeling sensation, and nystagmus also. Hypersensitivity, you know, because of the photosensitivity only, you will see skin rashes, urticaria, sometimes affecting the glossitis, your mouth, pruritus, and vulva, even exfoliative dermatitis also. Doxycycline, main doxycycline or in tetracyclines, because of their irritant property, they will cause diarrhea. Okay, but sometimes they will cause super infection also, especially in the intestinal by Candida albicans. Okay, but doxy and vino are less susceptible to this super infection. So what are the precautions you have to take for this? Especially contraindicated pregnancy, lactation in children, okay? And if you are giving on patients with diuretics, blood urea will rise very severely. So a big no when you are using in patients with diuretics. So that is the reason whenever you are giving tetracyclines, you have to ask a good history of the whatever drugs you are taking, okay? Also, hepatic insufficiency, renal insufficiency, you have to use very cautiously, except doxycycline. And because of their expiry date, Fanconi syndrome, they should not be used beyond their expiry date. And also, you should, because of their crystallization property, tetracyclines, penicillins, you should never give and combine together in one syringe. Okay. Normally, now we are not giving any combination of drugs in one syringe. Okay. And then intrathecally also, you should not give tetracyclines. And this is the newer drug in this tetracycline, that is tigecycline. This is a derivative of minocycline, and this family name is called glycyl cyclines because of the glycyl ring in one of the 4 cycles. Okay. And this was discovered in 2005 only. Okay. And so it is used only for some infections, not all infections, because of the resistance property. Mechanism of action, same like it is preventing the chain elongation by going and binding to the 30th ribosome on the acceptor side and preventing the mRNA to bind to that acceptor side. Okay. Resistance, no resistance is developed once means no cross resistance is seen, because I told you that efflux pump influx pumps and the efflux, that is not there, because those pumps, they have low affinity to this drug, and this drug is also having good lipid absorption, so it can go easily. Okay. And another one, ribosomal protection protein, whatever I have told you in the before. Okay. That ribosomal protection protein is less active to the tigecycline. So this can go easily bind to that mRNA acceptor site, and then it can prevent the chain elongation. Spectrum, all gram-positive organisms where tetracyclines are resistant, gram-negative, the Vibrio cholera, all where the tetracycline is resistant, and some anaerobic infections. Okay, like see, Streptococcus pyogenes, Streptococcus pneumonia, staph, MRSA, VRSA, Enterococcus faecalis, these are gram-positive, vancomycin resistant Enterococcus, Acinetobacter, Rickettsia, Chlamydia, Mycoplasma legionella. All these are the same organisms which are there for the tetracyclines only, but these are the resistant strains. Okay, and Pseudomonas and Proteus are 2 drugs which are not responsive to the tigecycline. Okay. Pharmacokinetics, oral absorption is not very good, so only slow IV infusion is there, but it is widely distributed and elimination is through bile, so no problem here. And T-half is around 36 to 60 hours. Okay, so when you are giving, give a loading dose and then maintenance dose. Uses are, you can't give this tigecycline in all infections, because you have to prevent the development of resistance. Okay, so you give only in serious and hospitalized community acquired pneumonia. Okay, remember that chlamydia community acquired pneumonia is there. And again, complicated skin and suture infections. Okay, complicated intra-abdominal infections where because secondary infections might have taken place during those and the other antibiotics, still the infections are not responding. Okay, so only complicated infections where the other drugs are not responding means go for the tigecycline. Side effects, and the same side effects like that: nausea, epigastric distress, skin reactions, photosensitivity, and injection site complications. Super infections are also very good with this tigecycline, so that is why you can't give like everywhere with this tigecycline. Okay, same like that, contraindicated in the pregnancy and children. Okay, chloramphenicol I will tell you in the next class. So the gist of it is tetracyclines are very good. Okay, broad spectrum antibiotics. So these are very good. So you can use it like even fungi also doxycycline. I have seen in some clinical practice also doxycycline for the dengue also doxycycline will respond very good. The patients will give a very good response. Okay, so parasitic infections. So this is a very good drug. But what is the main problem is, see, you have seen the side effects. Every organ, this doxycycline and whatever this tetracyclines, it is touching. Okay, every organ will be touched. So we should be very cautious while using these drugs. Okay, so let's start with this one, attendance. Okay. While I was in the class, still students are coming. Very good. While I was taking class, it was around 100, 110. Okay, and now it has become 144. You people are making good use of this online class. So give your attendance. Roll number 1.
Present, ma'am.
2.
2 present, ma'am.
3. 3.